Awesome. Okay. Well, hello everyone. Thank you so much for joining tonight. I just wanted to give a brief hello introduction from me, and then I'll pass it off to Megan. But real quick, my name is Jessica. I'm part of the Genetic Counseling Prospective Student Network, or GCPSN. We're just an organization of prospective GC students. And as part of the community outreach committee, we like to organize events like this and spread the word about genetic counseling, organize presentations from awesome GCs like Laurie. So yeah, thank you so much for being here tonight. I guess a little background about me. I currently work in a clinical genetics lab. I'm a laboratory supervisor. And I am currently applying for GC schools right now. So I'm super excited myself about this presentation. But with all of that being said, I'll go ahead and hand it off to Megan. Thanks so much, everyone.
Thank you so much for the introduction. So I'll start sharing my screen with the slides we're gonna share right now. Can everyone see my screen? Okay.
Yes.
Okay. Thank you. So welcome to the fourth MOA meeting of this quarter. And before we get started with introducing our guest speaker, we're going to talk a little bit about our club. So before we start, we're going to talk about Zoom etiquette. Please respect the officers and the guest speakers during this meeting. So please mute yourself while the hosts are speaking, and please use appropriate language in the call and chat and be polite. And do not ask diagnostic questions. That would be for a different type of meeting. This is an informational meeting. And any members who don't follow this rule at all will be kicked out of this meeting. And this meeting is recorded, so it will be posted on a YouTube channel. So if you're uncomfortable with being recorded, please message any officer and we will pause the recording and ask the questions. And now we can get to the agenda. Emmanuel.
Yeah, so for today's meeting from 4 to 4:15, we're just going to go an overview of the guidelines and information about our club, running everyone in the Zoom etiquette and club itself. And then from 4:15 to 4:35, Laurie will introduce herself and present her own slides and resources. And then from 4:05 to 5 will be a Q&A session. So if you have any questions, please submit them there. And then from 5 to 5:30, we will do an intro and a Kahoot where we'll take a picture, sign up, and play an extra credit Kahoot.
So this is a little about our club system. So MOA has adopted a point system to encourage active attendance. So in order to earn extra attendance points for each meeting, please sign in at the beginning of the meeting and then sign out with the correct word of the day. That's how you get 2 points. And the sign out sheet is in the chat. So if you're interested in being an active member, please do that. And if you are watching this from a YouTube recording, you will have 24 hours from the time we basically post and announce this on our socials to earn 1 out of the 2 points. And there are extra credit opportunities, including a Kahoot and community service involvement. So I'll first talk about the community service involvement. So if you're participating in the community by donating blood or volunteering, please send proof to our email, dianzamoa@gmail.com, or fill out our extra credit Google form, which can the officer send in the chat. And you'll basically get a MOA point for each event that you do. And we do have a Kahoot in summer meetings. And this will be a maximum of 10 questions. It's usually 5 questions. So it's basically to check if you listened, paid attention during the meeting, and the top 2 players gets 1 point each. And why are you earning MOA points? Well, at the end of the quarter, all the points are entered in the raffle and the winner will win a prize. And our last meeting is in a few weeks, so make sure to earn as many points as you can.
So for our tentative events, so for the first one was, I believe, last week, where we talked about the pre-health transfer panel with the Namzer alumni who transferred. So for the second one will be today, where we are having a genetic counseling info session, where you guys can learn about the pathway to become a genetic counselor. And for our last event, it will be an in-person bonding event. So right now we are still planning the details for that. And for that one, it will be a week before finals, and we will meet with our members in person.
MOA has compiled all opportunities into a spreadsheet. You can access this spreadsheet through the QR code or the link in the chat. The spreadsheet contains opportunities for volunteering, conferences or webinars, scholarships, internships, and other programs. Also feel free to join our Discord, where you can connect with other members or get immediate updates or announcements. To enter the Discord, you have to click on the MOA icon, and that will allow you to have access to the rest of the Discord. I will paste the link to the Discord in the chat as well.
And this just kind of shows you how to enter our Discord, just like react with that. But yeah.
So these are ways that you can get connected with us. So those are all our social media links. You can use the QR code to visit our link tree or our emailing list or our Discord. We're mostly active on Instagram and Discord. However, you can also email us if you have any questions as well. And I'll leave the link. I'll leave all the link in the comments.
Okay, now finally, after introducing our club rules and how we run this club, we can finally introduce our guest speaker, Laurie Nemzer. She is a genetic counselor of almost 40 years, and she attended the University of Wisconsin for an undergraduate degree in social work. And proceeded to attend UC Berkeley for her master's in genetic counseling. Laurie, would you like to introduce yourself in a more detailed manner? Oh, you're muted, I think.
Sorry. Okay, let me first, I'm going to share my screen and get to the first slide. And in that, I will do the, I will definitely introduce myself more. Okay. So let's see. Wait, did I do that? No, you didn't. Are you seeing anything yet or no? Not quite. Hold on. Okay, here we go. Share screen. Okay. And then I do that and hit share. And then I go to slideshow. Let's see if you, okay, now do you see my slide? And you probably see it, right?
Yes, we do.
Okay, very good. So first I want to say thank you for that introduction and for inviting me to speak with your group this afternoon. Yeah, a few more words about myself. I started out in New York a long time ago. That's where I'm from. And I gradually went west to the University of Wisconsin for my college degree. And I was in social work at the time. That was my major. I had never heard of genetic counseling. And then after I graduated, I worked in a completely different field for a few years until I figured out that I wanted to go back to school in genetic counseling. I had first heard about it in the way that many people do, meaning that a speaker in my final semester in Madison in college, a genetic counselor came to speak to our class. And I remember at the time thinking, oh, this is interesting. And I kind of filed it away. But she sort of, and then I didn't, go into it right away. But then I think it planted a seed so that when I was ready to make a shift, I thought I remembered it. And I then did informational interviews and, talked to more genetic counselors and went back to school for a few science prerequisite classes that I needed because I hadn't had them. And I got some counseling, volunteer experience and did all the things that, one does to apply to graduate school. And we'll talk more about the admissions process, in a bit. But when I started, the field was very new. There were 7 genetic counseling programs across the country, and now I think there's, I don't know, something like 70 or, it's really grown quite a bit. And since clinical training or working in an internship or a rotation is a big part of the graduate programs, I happened to get a rotation at Kaiser in Oakland. And I made some good connections there. And then when I graduated, I was offered a job. And then I worked there for the last 38 years. It's kind of amazing, but I was in the same location. I did many things, but I was in the same job. And I just recently retired from Kaiser. So, and about 10 years into my position, I started teaching just one class, one morning a week. I was teaching in my alma mater at UC Berkeley, where I had gone to the graduate school. And then I went on to both teach in and direct the genetic counseling program at CSU Stanislaus. So for 12 years, I had 2 supposedly half-time jobs, but anyone who has worked part-time in this kind of profession knows there's really no such thing. So they were kind of like 2 full-time jobs. I would describe myself as a workaholic for many years, but it was very, engaging and wonderful, but it was a lot. So I did these 2 roles for a long time. I did clinical work at Kaiser and the educational work through CSU. And I do have a particular interest in mentoring prospective genetic counseling students. And while I was at Kaiser, I coordinated a shadowing and outreach program. Whoops, hold on. I was trying to advance the slide. Oh, there we go. Okay. So today's goals or objectives, we're going to talk about, hopefully you'll understand what a genetic counselor is, discuss what a genetic counselor does, and understand how to become a genetic counselor. I'll give a short presentation and as Megan said, we'll then open it up to questions. And the National Society of Genetic Counselors, which is our professional organization, they define genetic counseling as the process of helping people understand and adapt to the medical, psychological, and familial implications of genetic contributions to disease. And I would suggest for anyone who's really interested after, we talked today, I would recommend you go on their website. It's nsgc.org. And it's a really great website with a lot of information and resources for people if they're interested in, knowing more about the field. So what do we do? What do genetic counselors do? In general, these are generalities, of course, but we assess for genetic risk of disease. So that means we interpret family and medical history to determine the genetic causes of diseases and risks for disease occurrence or recurrence. We promote informed decision-making, meaning we empower patients with knowledge, tools, and resources to make their best decisions in regards to testing, health management, and disease prevention. We don't do a lot of recommendations. A lot of, physicians and other healthcare providers perhaps, recommend treatment plans and so on. We tend to be more on the non-directive side and trying to help people make their own decisions. And then we interpret and communicate results. We interpret clinical meaning of test results, communicate findings to both the patient and to other healthcare providers. And we provide support to promote adaptation to the condition or to the risk. So when I first started, most genetic counselors were working in prenatal or pediatric genetics in large medical centers. But that was before the Human Genome Project, before Angelina Jolie made one of the breast cancer genes famous, and before there was such a thing as cardiac genetics or neurogenetics. So, things have changed a long time. I'm a bit of a, I call myself the grandma of the profession, not quite, but I'm really been in it a very long time. So there have been I've seen amazing changes in both the technology and the career. And we have now learned that there are genetic conditions that can affect people throughout the life cycle. And so genetic counselors work, in addition to the ones I mentioned, in addition to prenatal and pediatric, they work in cancer genetics and cardiology and metabolic and neurogenetics and hematology, pretty much any medical specialty you can think of. And that's the clinical side of things. Now at Kaiser, one of the things that attracted me to the position and that attracts a lot of people is we were what's called a generalist, meaning we didn't really have to specialize. We got to do a little bit of a lot of things, which was great for a long time because it was so interesting. But as time went on, it got challenging because it's hard to keep, it's really kind of impossible to keep up with the literature in every, in all of these fields. And so with time, we've specialized more. And now most of us do, a couple of specialties as opposed to just everything. But it depends on where you work. Some places people just do cancer genetics or they just do prenatal genetics, but Kaiser is one of the places where you can have the opportunity to do, a variety of things. And that's just the clinical work. Then there are many jobs, more and more jobs in what I think we call industry, which in general are genetics laboratories or startups. And those people, the people who genetic counselors who work in industry, do think they're kind of like the liaisons between the clinician and the lab. And they explain the test results to the clinicians. Like I called them all the time and they were very, very helpful. If I had a patient lab report that I didn't fully understand, I would call and review it with a genetic counselor who worked at the genetics lab, which was very, very helpful. Sometimes I think they write patient or provider education material. They explain tests to like I said, to clinicians, and for those who are really interested in the more basic science genetics part of it, they can do variant interpretation and write lab reports. So that's that's part of what people do in industry. And then there's other miscellaneous type of work and more opportunities. For example, people work in nonprofits and public health genetics. They work in insurance companies. For example, I know of a counselor who's now working in an insurance company, and she's kind of like the gatekeeper. She tells that she's there to help the insurance company, people who don't know anything about genetics, when they get a bill for a test, she can tell them whether it was like appropriate testing and whether they should, whether she would recommend paying for it, that kind of thing. So there's a wide range of opportunities. And one of the things that's nice is that you can move between them all. You can work, in clinical work for a few years and then decide you want to go into industry, or you want to work for a while in prenatal and then you decide you want to go to cancer. So there's a lot of movement and a lot of ability to expand one's skills and experience. Okay, so a day in the life. I was thinking of giving you a sense of my life a little bit in the 12 years that I was working for both Kaiser and CSU. So for example, I might in the morning have seen a couple of patients by either video, telephone, or in person. Since COVID, we've been doing a lot more video, but it depends on where you work and the type of patients one sees. So for now, I think a lot of people are working hybrid. A lot of people go into the office or to the clinic 2-3 days a week, but many jobs, including the industry ones, I think are primarily remote. So there's a variety there as well. But telemedicine is certainly on the rise. It's more, patients find it more convenient. But seeing a patient involves a lot more than the time that you actually spend with the patient. It involves researching the condition that they're referred for, reviewing their medical record, consulting with other medical providers, for example. And like I worked with a few MD geneticists or clinical geneticists, or you might work with a MD high-risk obstetrician or maternal fetal medicine doctor. After seeing the patient, there's documentation to do. One has to write chart notes or patient letter. Sometimes we do referrals to other specialists or community organizations. I then might have taught a class on if it was a certain day of the week, I might have taught a class. And I taught mostly classes in the psychosocial aspects of genetic counseling, partly because my background was originally in social work and psychology, a little more. I came from less of a hardcore science background than many people do. But and I have a particular interest in the emotional impact of genetic conditions on individuals, as well as an interest in ethics. So I might have taught a class, I might have graded some papers, I might have prepared for the next day's patients, attended a meeting with my coworkers to discuss a challenging case, or an interesting case. There might have been an educational rounds at the hospital. A lot of times they have lunchtime grand rounds that sometimes weren't really related to genetic counseling, but were super interesting. If I was working on a research project, which I did a little bit of clinical research, I might have given some time to that. So every day is different. And I can say it was never boring. I mean, you're always learning. There's always new conditions to learn about, new technology to learn about. We really specialize in the rare disease, so I would say that even after 38 years at Kaiser, every week, at least every week, once a week, I would have a disease come across my desk that I never heard of. We would see cases where there's 8 reported patients in the world of this particular condition. So a lot of things that, before you go into the field, you really never heard of because most people haven't. And all of a sudden, you have a whole world open up to you about rare conditions. And it's very interesting, Okay, so some general categories I thought I would just review, like not necessarily a specific patient, but the kind of cases. So for example, in prenatal, much of the work centers around options counseling, which is explaining testing options to either patients who are pregnant or patients considering a pregnancy, or we worked a lot with patients with infertility. So that's one type of prenatal case, was an options counseling. Then another big group, we're reviewing results of testing. And we give both good news and difficult news. Telling someone about an unexpected result is always hard. But being with people through crises and difficult decisions is also one of the most rewarding parts of the work for me. And I think I would say I saw myself as an interpreter of results. Like, for example, a lot of it's in really high level, high tech language, and most people don't have that background. So our role was to put it into lay person's language. A pediatric case could mean anything from a referral of a child who isn't developing as expected. So for example, a child who isn't talking at age 3 or isn't walking at age 2, or a child who's struggling with learning in early school age years. So those are kids who would come into a genetics department for what we call a genetics evaluation. And in those situations, I would work with an MD pediatric geneticist to evaluate the children to see if we can come up with an explanation, a genetic explanation for the concern that the family has or that the doctor or the pediatrician had. And that can often involve a physical exam that the physician did. We don't, as a genetic counselor, we generally don't touch anyone. We don't actually, do physical exams, although we can order lab tests, the genetic testing. We don't actually, we don't use, we don't ever listen to anybody's heartbeat or anything like that, or I didn't anyway. I don't think people generally do. That's why we work in conjunction with the physician in those situations. And then the genetic testing can be offered, which is done by either blood or saliva. So those are pediatric cases. And then if we got a result back that was significant, we would then meet with the family again for follow-up to go over the results and explain what it means for them. Now, for adults, these types of cases could mean anything from working with people who have cancer or a family history of cancer, or have a concern, or it could be somebody with a concern because one of their parents had an early onset of Alzheimer's disease, or they had 3 uncles who had early sudden heart attacks. Those are the kind of adult patients that we would see. And then specialty really refers to the fact that there are people who even specialize further than, like, even more, they specialize more than even saying I work in cancer. They would do things, they'd be an expert on a particular disease, for example. Like you could have a genetic counselor who works only in cystic fibrosis clinics, or someone who works only with blood disorders, or someone who works with a condition called spina bifida. So those are examples of some of the range of the work that you might encounter if you come into this field. Okay, so this is one of our favorite tools. This is called a pedigree or family history. And the squares represent people who were born male, and the females are the circles. The circles are represent people who were born female. And we work a lot with these, and we draw them a lot. They're used for many reasons, but for one of the primary reasons is to just help us see a pattern of inheritance in a family of a particular condition. You may have seen these if you've taken genetics. I don't know what everybody's background is, but it also helps you understand psychosocially a little bit about it. You know, how does this person have siblings? Are they going to have to talk to their children about a condition? You know, you get a sense of the family constellation. But for example, in this pedigree that I'm showing here, we can tell that this pedigree represents a condition that's being expressed in what is termed an autosomal dominant fashion. You may have had this in genetics class, but you can, the blackened symbols are the people who have the condition. And if you have the condition, you have a 50-50 chance of passing it on. So you can see, like in the second generation here, people had a 50, the people, there were 4 affected siblings. And then 2 of the siblings went on to have affected children, but 2 did not. And if you don't have if the person did not have an affected child, they couldn't pass it on to their child. If you don't have it, you can't pass it on. But if you have it, it's a 50-50 chance. So that's like an example of what we might gather from looking at a classic kind of pedigree. Okay, so why would someone choose this field? It allows people to work in a healthcare setting while developing meaningful patient connections. And I would say that it's still true. It was even more true in the past, but it's still true. We get to spend more time with patients than the average healthcare provider. So it allows for a really good connection because you do have more time with your patients. It's a mix of hard science, psychology, and social interaction. And that's, there's a sort of a cliche that most applicants who come into this field, including myself, all of us, when asked, why do you want to be a genetic counselor? Most people say, well, I love science, but I want to work with people. Or we get a lot of people who have come from lab jobs where they've done bench work and they're tired of working in the lab and they decide they want to do something that, has more meaning or to them, or that they feel, is more meaningful. Or like, for example, we had several people in the CSU grad school who were PhDs. We had a handful who never heard of genetic counseling, and they went to get their PhDs in genetics or biology, some sort of science. And they were kind of at the end of their dissertation, and they had worked so hard for all these years. And then they learned about this field, and they decided that they wanted to do this rather than to, use their doctorate. So they then applied to genetic counseling school and went back for a master's. And a few of them are working as genetic counselors and thrilled. And, we're sort of sorry that they didn't know about this opportunity before they had gone on for the full doctorate. So, that's it's an interesting thing that would happen. We used to be a little hesitant to take those people, but over the years we realized that they were very honestly interested in doing the counseling. They just hadn't heard of it before. It provides, as I said, diverse learning opportunities. You're always learning. There's many opportunities. There's many opportunities to change specialties, like I said, and work settings. And I think another real important thing to me is I really love the genetic counselors I've worked with. It's just a wonderful community, and you just feel like you're working with supportive people. And it's very much a collaborative field, and one where we work in a team. So that would be another strength, I would say. Okay, a few career facts. The U.S. Bureau of Labor Statistics projects a 26% growth rate from 2020 to 2030 for genetic counseling positions, much faster than the average growth rate for all occupations. And 71% of genetic counselors who graduated in 2021 accepted a position before graduation, with 7 out of 10 of them having the job 2 or more months prior to the graduation. The average salary is about $102,000, which has increased 25% since 2016. The range is from $60,000 to $257,000. although I'm not, I chuckle at this 257. I wonder who that person is, because I don't know anyone quite that high, but there's obviously a big range, and it depends a little bit on your years of experience and on the location, what part of the country you live in. I believe there's some geographical differences. And then probably most important, or equally important, I should say, 9 out of 10 genetic counselors reported that they're satisfied with their jobs, which is quite remarkable, I think, for a profession. Okay, so there's definitely a strong national and regional focus on increasing diversity and promoting inclusion within the genetic counseling profession. This isn't new. We've been trying to do this for years, but I don't think we were very successful for many years. We're doing much better. I feel like there's finally some movement, which is very nice for me to see. It has been a predominantly female field. That's changing. More men are hearing of it and joining, which is great. And I think there's much more emphasis now on training counselors who look like the communities we serve, who can counsel in languages other than English. And I would say one of my favorite parts about my job in the Bay Area was seeing patients and working with students from all over the world. And it was a real perk of practicing in this area. So hopefully that's just going to continue to move forward, and we'll have more and more diversity in the field. Currently, as we're talking, there's a national meeting going on in Nashville from the NSGC. And I'm not attending, but I spoke with a colleague who said that a big focus of it this year is on the justice, the JEDI, as they say, issues. So I'm glad that finally people are really giving it its due diligence. Okay, so how do you become a genetic counselor? It does require a 4-year college degree, so a BA or a BS. So for those of you, since this is, I take it I'm speaking with a community college, so you would need to get your AA, I suppose, and transfer to a 4-year university to get a bachelor's. But you don't have to major in science, and we'll talk about that in a minute, but you need a bachelor's degree. Then there are certain prerequisite courses that I'll show you in the next slide that vary from program to program, but there's some similarities and overlaps among the programs. The GRE used to be required. It really is now. There's some programs do require it and many do not. That's a exam if you're not familiar with it, kind of like the SAT if people took in high school. Then people go through the 2-year genetic counseling programs. They generally are 2 years plus the summer in between the 2 years. That usually people are doing like an internship during that summer. And then when you come out of school, you graduate after the 2 years, and then there's a national exam that people sit for, and that allows them to become what's called a certified genetic counselor. But the path to starting a genetic counseling career really does look different for every individual. It's not always a linear process, and your diverse experiences do bring a lot of value to the profession. I can tell you, having sat on several admissions committees, we really like, we like diverse students, but we also like returning students who are older, students who have life experience, students who have children. I mean, there's no right applicant. We have now, I would say, more and more people are genetics or biology type majors, but not solely. We at CSU, I recall taking an Italian major and a Spanish major and a philosophy major and a psychology major. There are returning nurses. So as long as people have some solid foundation of science and have had some of those prerequisite courses, you don't have to have a molecular biology degree. And I'm a good example. So, but I know I was from a long time ago, but still I had the degree in social work, and I then had to learn the science along the way. But we also have people, it is somewhat of a competitive process to get in because the programs are small and there aren't that many, even though there are many more than when I started. But and occasionally, sometimes it takes people more than one try to get in, but that's not seen as a negative. Like we would take people who were re-applicants every year. We had some students who needed a little more time to strengthen their application, and we would take them the second time around, or, so not to get discouraged. And these are the typical required and recommended courses. Of course, as we mentioned, genetics and biology and psychology. I would say statistics is important because we deal a lot in probabilities and risk figures. So it's helpful to understand statistics. The rest of it varies. For example, you don't need to have an anatomy class. I think it will be helpful, but it's not required by many programs. So it kind of depends on where you're applying, and you would take a look at their prerequisites. And then the other recommended experience, which strengthens an application, is for people to have some sort of counseling or advocacy experience. And that could be crisis counseling, like there's a lot of telephone hotlines or crisis lines. Some people are doing text counseling these days, texting hotlines, or peer counseling. It really doesn't matter like which subject you decide to counsel in. Like, for example, it depends on what interests you. Some people go and get experience in working with kids with special needs. Some people go and do something in reproductive health. Some people do hospice work, domestic violence work. It doesn't really matter as long as it allows you to work with people and see if you enjoy working with people and see if it's a good fit for you. That's the main purpose of that experience. And then many people come in with some sort of research. It could be, working in a lab or doing a capstone project as part of their education. It could be doing some sort of clinical research where they enroll people in studies. Not a mandate. You don't absolutely need this. These are just things that would add to an application. And then the genetic counseling exposure, doing what you're doing today, listening to people like me talk, learning about the field, going for informational interviews, going to webinars and conferences. Most of the programs have like open houses or information sessions. And then if you can get any kind of shadowing where you can sit in on some case, some genetic counselors doing their work, that's fantastic. I'll put a plug in for, I know that I'm sure there's more than this one course, but I know that at UC San Diego Extension, there's an intro to genetic counseling class. It's like a career, learning about the career, and probably a little more, more than what I'm doing today. But, and there are also jobs that are called genetic counseling assistants that are basically in major medical centers, usually like places like UCSF, and they're also at a lot of the genetics labs. And those are paid positions, full-time jobs that people sometimes take when they graduate college before they go back to grad school. And it's like an assistant job, but you're in the genetic counseling department, and it's a wonderful opportunity to learn about the field. Again, not a requirement to go into grad school, but we did get some people who had those positions, and then they decided, they wanted to go to genetic counseling school. Okay, so some resources, there's lots out there. There's genetic counseling program directories to see where are the programs and what are the requirements. There's, as you met someone this morning today, with the Prospective student networks, there's help with applications, and I am available to, if anyone is, at all serious about considering this, I'm very happy to talk with you individually and give you some more local resources and connect you with other genetic counselors. And I can sometimes arrange for someone to do a shadow, like a one-day shadow at Kaiser. So feel free, and if anyone's interested, we can get you my contact information after today. So I think that's all for now, and I want to open it up for questions.
Okay, thank you so much for that informational presentation. Now we're going to move on to a Q&A portion where you can either unmute and ask your question or type in the chat. And if you feel uncomfortable with being public, you could just privately message me and I'll read it out loud. So yeah. Well, I have one question, which is because there is always things that you like and dislike about everything. So my question for you is, what is one thing you like about your profession and one thing you dislike?
So let's see. Well, I think I like a lot of things more than I dislike, but I mentioned a lot that I do like. I really like the connections and interactions with both my patients and my colleagues. Those would be, two of the primary things. I love this. I love the science, the learning, all of that. I mean, there's really a lot that I liked. Dislike, I think we're very busy. I think currently that it ebbs and flows, but I think sometimes people are working really hard and sometimes it was like a little much. And, you have to keep up because you have to keep up with making sure you're giving people current information. The chart notes, it's like any job, there's paperwork that has to be done. I mean, it's not paperwork anymore, it's computer work, but you know what I mean? The admin kind of work that I think for me was, I wish I could just talk to patients all day and I didn't, but I had to write up the reports and, that wasn't something that would hang over my head sometimes. And, I didn't love that part, but it had to be done, of course. And I understand the importance of it. So I think with most jobs, there's stuff that you love and stuff that you kind of just have to do,
Okay, thank you. We have another question. Can you explain how many hours you work a week / per shift, and how the work-life balance is for genetic counseling?
Yeah, well, I think it does depend on the job. So I'm not a great example because I really had these two jobs. I'm going to just tell you from some of my colleagues at Kaiser who are, who joined us more recently. I would say a lot of them can keep it to a regular 8-hour day. The shift is usually a daytime shift, 8:30 to 5 or 9 to 6 or something like that. So there is a lot of flexibility. I should mention this. There is a lot of flexibility in the sense that I had children. I have 2 grown adult children now, and when I had them, I was able to work part-time when they were young, and I was able to vary my hours. There was a period of time where I found it better for me to work 5 shorter days so I could be with them after school, and I was able to do that. I mean, now granted, I had a flexible job. It was great. I don't know that I can't say that every company will let you do that, but there is a lot of flexibility. There are people working both full-time and part-time. So I think in terms of life-work balance, I think it can be done. I think there are jobs where, I really think it varies. So I would say you just have to advocate for yourself to keep it within appropriate limits. And I think like anything, there are busy times and quieter times. So it ebbs and flows a bit. But in general, I think it is a job. It's not like you're not in med school, from what I've heard, you're not like in a residency program where you're working 24/7. It is a job that you can keep contained to workplace, to normal hours, I would say.
We have another question in the chat. So someone said that they wanted to be a genetic counselor since sophomore year of high school. So she's excited and honored to be meeting you today. And she said, I know you mentioned various opportunities and resources for strengthening applications for grad school, but I was just wondering if you had any recommendations for opportunities that students can do while balancing schoolwork as well. Because the required prerequisite courses or STEM courses that are like pretty hard. Also, they would like to get your contact information and would love to know more about your career experience.
Okay, well, yeah, well, we can, I don't know, later we can talk about how you want to get that to them, but I'm happy to, you can pass on my email to anybody in this room. Okay. But in terms of your question about how do you do it while you're in school, and it is hard. I think you might start, I don't know if I heard you before I started speaking, someone talked about community. You mentioned something about working in the community or volunteering in the community. Anything you can do, even like if you could do 1 shift a week at a hotline or something, you can do that from your home in the evening, one sort of volunteer thing, to get started with seeing if you some sort of peer counseling thing. That would be one suggestion. I would also say that, everyone's different and everyone's, situation is different financially and so on. But there are people who really can't do it while they're in college. Like they can't strengthen their application enough. So they decide to take like a gap, take some time off after after college, not necessarily time off, but time where they're focused on strengthening their application. They can be working, but they can work doing something that maybe is not as complicated, or something, just get a job to make money and then do in the same time be working on strengthening their application by doing these shadowing things or doing these informational interviews or getting more volunteer experience. So again, it's true, it's hard to do it all while you're in college. Some people manage it. We definitely, every year I would say we took, a couple of people who were straight out of college, but there were many people who were coming back, even a year or two after. I don't know if Megan wants to chime in. Do you know, what would you say about that question? Because you're doing it, right? Not Megan, sorry, not Megan, Jessica.
All right. Yeah. I can totally speak to that. And I'll totally include I'm going to post right now. This is the link tree for the Genetic Counseling Prospective Student Network. You can check it out. Hop on our Slack. We have conversations like this all the time. But yeah, I am someone who I actually graduated from college in 2018. So I took a number of years. I didn't learn about genetic counseling until kind of right after I graduated, but I took several years or a few years to gain experience. I work in a clinical lab, like I said, and I volunteer on the text line, the crisis counseling, which is something I would totally implore you to check out now. It's pretty manageable. You pick your own times that you do it. And yeah, just gather volunteer experiences, talk to genetic counselors. So there's a lot of things you can do. And yeah, I think I'm super glad I took some time off to prepare and become a confident applicant. But totally check out our resources or hop on our Slack and we can even talk about it more too.
Thanks.
Okay, thank you. And if you have any additional questions, just put in the chat or raise your hand in the mute. But we have another question. We noticed that you mentioned how the schools for genetic counseling is limited or small, compared to other professional schools. So what factors do they look at, like GPA and test scores, or and how is the acceptance rate compared to other professional schools such as medical and nursing schools?
Such as what? Nursing and what?
How is the acceptance rate compared to professional schools like medical school?
Right. I don't have any statistics in front of me about that, so I don't know the answer. I can tell you, and again, maybe if Jessica knows, she can pipe in, but I can say that the reason the programs are so small have to do with the fact that we have to arrange for all the clinical rotations. So a lot of the programs have, 12 people, some have 9 people. There used to be ones that had 4 people. I mean, they were really tiny. Now I think they're trying to increase them a little bit, but there also, I should mention, are an increasing number of online programs. I'm not, there's a few anyway. And then of course with COVID, a lot of it is still sort of hybrid-y, I think. I'm not sure, but so that's part of it. We would have wanted to take many, many more students. And in the classes, you can take more students, but there aren't enough genetics departments in a given area to we want to make sure everybody gets really solid, good training. So and without overwhelming the clinical people in the field, we can't, do it. We want in the program I worked in, everyone got a rotation in prenatal and pediatrics and cancer, and to get all of that experience takes a lot of coordination and a lot of sites available. But I'm digressing. The question you asked is, what do they look for? I mean, yes, grades and GREs used to be super important. I think now there's an effort, which I'm happy about, to look more at the whole person. And that's why your experience and your life experience is important. When you write your essay, there's usually a personal statement as part of the applications. And again, I'm sure Jessica's network can help you with all this, but I would say, just from my own experience of reading them, I always liked when people told their story. They told what got them to this field. Sometimes people come into the field from a personal experience. They've had a family, they have their own family history of some sort of genetic condition. It's pretty common. Or they were moved by meeting someone who had a disability or whatever it is. And you don't have to have that, but anything you can do that makes you stand out as someone different, and we get to know who you are, I think is a good thing, because it is a very interpersonal, type of field. And we want people to be open and willing to share of themselves, because a lot of the training is, being someone who's open to personal growth and development, and yeah. So in addition to the grades, the things that were listed, the grades, the GREs, I think the volunteer experience is important, like to make sure that you've done some sort of counseling. And then I would say to do your homework about the field, so we think that you at least, are not going into it blind, that you've had some exposure to it. Those would be the main things I would say.
Okay, thank you. There's another question in the chat asking, are there any differences between a genetic counselor that works in outpatient versus inpatient settings?
I don't know of that many genetic counselors who work in inpatient. It's more often outpatient. We would do inpatient consults. So like, for example, at Kaiser, I would be in the outpatient clinic, like across the street from the hospital. And the doctor I worked with would get a call that there's a new baby born in the nursery that looked unusual or had some sort of medical problems, a heart problem or a breathing problem or something that got the doctor concerned that maybe there's some sort of genetic condition. So we would go up, go into the hospital and go up and meet the family and see the baby, inpatient. But it was always sort of part of my role. And I imagine there are some across the country that do inpatient, but it's not like a huge part of my, what I have seen in genetics. It's mostly outpatient.
Okay, thank you. And I have a question when looking at your informational presentation. It looks like the only way to become a genetic counselor is to earn an MS degree in genetic counseling and then taking the exam. Is that correct?
I think that really is correct. I mean, there's, yes, I mean, there is, like I mentioned, this like alternative field called genetic counseling assistant, I think is the term. They call them GCAs. And that is a profession one could go into if one didn't want to go all the way through genetic counseling grad school. And so those jobs are listed on just hospital HR sites and stuff. And like I mentioned, I know there are a couple of programs. There's one at Johns Hopkins and there's one that's starting at UC San Diego Extension, where they're trying to sort of focus more on just teaching people how to what's needed to become a genetic counseling assistant, which is related to what's needed to being a genetic counselor. It's just probably a little less, it's a shorter program. And I'm sure the people, are not paid quite as much, but it still would allow people to get working in some related field if they wanted to do that, or at least try it out, so that's another thing. But to answer your question, yes, it's all there's an accrediting body. It's all very standardized nationally. Like you have to have this license in order to practice. Yeah.
Yeah, because I'm asking because I know for like nursing, there's like different pathways you can take. You can either go straight into bachelor's, straight in ADN, and then take the exam, or get a bachelor's and do a MES, and I don't know the term, but like, yeah. So I was wondering if there were like alternative pathways.
Not really. I mean, I think we're still a relatively small field. I mean, even, I don't know how many genetic counselors there are in the country, but I don't think it's way more than 5,000. I mean, it's pretty small still throughout the country, if you think about it, compared to like nursing and, MDs. So, I mean, there are people who call themselves like genetic nurses. Like there are some ways to work in genetic fields and there's probably a bit of overlap in roles. but you're not, like like there are nurses actually at Kaiser where I who do some of the, they do some work in what we call prenatal, or it's not only prenatal, but screening programs. Like they work for the state of California, helping coordinate some of the testing programs. And so they're within the genetics department and they're trained as nurses, but they're not licensed genetic counselors, so I don't know, so unfortunately, or I don't know if it's unfortunately, but it does limit, I guess, that people do have to go for this extended education. Yeah.
And what you mentioned before about the genetic counseling assistant, have you ever like seen the pathway of genetic counseling assistant to genetic counselor, like that pathway?
Yeah, often. I mean, those are like often people like Jessica who graduate and want to take some time away from, they're not ready yet to apply to grad school. So they want to work, maybe they need to work to put food on the table and they forget a job, but they have in mind, they want to be a genetic counselor. So I would say a lot of genetic counseling assistants actually do want to become a genetic counselor, but this is a way that they can learn more, take their time, strengthen their application. And so they get a job. They don't have to have anything. I mean, they need the bachelor's degree, but they don't need anything else to get the genetic counseling assistant job. And it just is a very good launch pad. Like we accepted students, it wasn't uncommon that we accepted a student who had been a GCA. But I mean, in a class of 9, maybe there was 1, or sometimes 2. It wasn't like every person, but it was something that is certainly a strength. If it would be a good position to take if you're interested in genetic counseling. I think what Johns Hopkins and now UC San Diego are trying to do is they're thinking about students who maybe don't want to, for some reason don't, or maybe can't or don't want to go to grad school, but they do want to be involved in the field. So a person could be a GCA as their terminal degree, that would be what they did. And they wouldn't be going on to genetic counseling school, but the majority of them do. The majority of them, use it to apply to genetic counseling school. They might do it for a year or 2 and then they go on, And some of them are great. I mean, I've called labs with a complicated test result, and I thought in my head, I'm thinking, I need to talk to the genetic counselor, and the genetic counseling assistant answers the phone, and 99% of the time they answer my question. I never have to talk to the genetic counselor. I mean, they learn and they really are functioning as, they a lot of times they're functioning as genetic counselors, I think, but they don't have, the title or probably the salary.
Yeah, we have several members of the board at the Genetic Counseling Prospective Student Network who are currently GCAs, and say it's just such a cool experience, especially like Laurie said, kind of having in mind you're interested in genetic counseling, you get to get that awesome exposure, possibly patient interaction, all sorts of cool opportunities.
Yeah.
Okay, thank you. And there's a question in the chat that was just asked. What has been your most memorable moment and anything that sticks to you from your experience?
Anything that sticks to me?
From your experience as a genetic counselor throughout the years.
Yeah. I don't know if there's one moment, but I would say the 2 things that come to mind are being, from my patient experience, it's really being with patients at times where they're most in need. And when you're in the middle of it, it's really like painful. I mean, people are grieving, people are having a hard time, but they so appreciate you, and you just have this feeling that you've really made a difference in people's lives, and they come back later. Like, for example, in a pregnancy thing, they might have a really hard pregnancy related problem. And regardless of what they do in that pregnancy, they'll come back in a next pregnancy, and then it's maybe great news and you're celebrating with them. And there's a lot of, really nice moments that are, just sort of human, very human. And then in terms of my teaching, I love that I have all these alumni. My supervisor the last 10 years at Kaiser was a student of mine. I mean, it's amazing. Like a lot of my students become my colleagues, and it's been really fun to watch. And I have a lot of friends. I have a lot of friends who are, personal friends who I know from work. It's a field that, the lines can be blurred a little bit between professional and personal because there's such wonderful people. So I really love that I've, mentored a lot of students who are doing great work. One of my students in the first class of CSU is now on the board at NSGC. And I feel like I'm very proud of them, and it's really fun to watch all the students go and do great work. So those are my two, sort of accomplishments, I would say, is, touching my patients' lives and touching my students' lives.
Yeah. And I had a question about like the gender identity of genetic counselors. Do you think there's a reason for why such a large percentage of genetic counselors are female or identify as female?
I think it has to do with the history of the program. The first program was at Sarah Lawrence College in New York, and I think it was founded by this is like in the late 60s, I believe, early 70s. And it was founded by some, I want to say middle-aged housewives. They were women who were kind of like looking for something to do, go back to school. And at that time, they were really, I used to joke when I got into the field that I didn't want it to become like a glorified, secretary. You didn't want to it had a much lower status when it first started, and the salaries were not very good. And I think just the way our society works, men were looking for more, salaries that were better and more status. But that has totally changed. And now the field, we have a lot of I feel really very great. I mean, I just feel great about the profession. It's gone up so much in sort of recognition and people knowing what it is. When I started, you would have to explain, no one had heard of it. Everybody would talk about, oh, you're counseling jeans, like, denim jeans, your pants. No, they would make jokes. Nobody knew anything about it. And now, people, if you say you're a genetic counselor, people are always like, oh, they're impressed, so it's really changed. And I've seen in my work at Kaiser, like we are very well respected by the physicians we work with and by the whole team. I mean, we really come to the team with a lot of expertise and anyway, I think that's part of it, is just the history of that we were in a lower status, which went along more, unfortunately, with women's work in those days,
Thank you. We have another question. What do you recommend to people who are interested in genetics, and what opportunities are open within genetic counseling?
So what do I recommend for getting into school, or I'm not sure if I understand.
Just, I guess, like, just genetics in general, and like if genetic counseling is for them, I believe.
I would maybe start on some of the websites, like the NSGC website gives you a lot of ideas and I think they have a lot of like webinars and things you can do. They also have some you can watch a genetic counseling session, like videotapes of them, and you can sort of see what it really is like. I think there are I don't know if you just Google it, but there are other lists of, careers in genetics, because you don't have to go into genetics. You could like genetics and feel like you want to work in the lab and do, genetic discovery. That's obviously another path. There are definitely other paths in genetics. So I think it's a question of figuring out, do you want to counsel people? Do you want to work, with people, or do you mostly are you more interested in doing the genetics, or are you wanting to do a combination of the genetics and the interactional work, but yeah, and I'm happy to talk with someone, afterwards, I don't know. I would just suggest you check out some of the resources that we had on that final slide.
Thank you. And there was a question in the chat again. What are ways for people to specialize in a specific field / disease in genetic counseling?
Well, I think that you start out, all the genetic counseling programs teach you, everyone has to learn, prenatal, pediatrics, cancer. There's a certain body of knowledge that everybody gets. And then I think if you think you have an interest in something, you might ask to be placed in a rotation and that particular specialty, for example, or a lot of times people learn about it in genetic counseling school. You don't have to know that now. So, I mean, I have a recollection of a young woman who she was in the program and she really thought she would hate cancer genetics. I think she maybe had lost a family member with cancer and it was very emotional for her. And she was in tears, like, I don't want to do my cancer rotation. And we said, well, you kind of have to, because, you know, you have to have this information to sit for the exam and so on. So she did it and she loved it. Now she's a cancer genetic counselor. Like, you don't really know until you try, like, what you're going to like and what you're not going to like. So I don't think there's one path, but I mean, in terms of specializing, but I think you can, you know, it's good to learn about it all, and then you'll see what kind of what you're attracted to, I think, you know, and then you can figure out ways to meet the people in that field. Going to meetings is a good way. There, you know, there's a lot of educational opportunities and meetings which are both fun and you know, informational, and so you can, you know, there are special interest groups within the professional organization. So if you have an interest, for example, in this, like cardiology, you can join like a little cardiology committee. I mean, there's a lot of ways to, you know, further your interest in a specialty.
You mentioned meetings and conferences, I believe. So to find those resources, would it be on the slide you shared? The meeting resources?
Yeah, I mean, the meetings I'm referring to usually are attended by people once they're in the program, you know, but there are special interest groups for students. And maybe again, Jessica, why don't you pipe in for this? Is more your good for you.
Yeah. So yeah, we have all sorts of, you know, the GCPSN that I keep referring to, you know, that's kind of our whole thing we do is putting on events and hosting things so folks can learn more about genetic counseling, can learn about opportunities to improve their application. We do a lot of workshops. You know, we even just finished up a personal statement swap yesterday. And so yeah, we have all sorts of events you can attend just to learn more about the profession, to learn about the journey towards application, all that good stuff. So yeah, totally check out the Genetic Counseling Prospective Student Network if you're interested in attending some of those events. I'll go ahead and post the link one more time in the chat.
Okay, thank you. Yeah. We'll also put this out on our resources, opportunities and resources spreadsheet. So don't worry if like you missed it. And yeah. There was another question in the chat. Do genetic counselors have to take continuing classes like doctors and nurses every few years to keep their license?
They do. There's continuing education requirements, and that's why we go to these different meetings. But there are lots of ways to do that. You can actually attend a meeting in person. Sometimes you can get them online by doing, you know, different classes or courses or webinars. You can get them. Some of the hospitals have, you know, a series like a genetics seminar once a month, and you can get CEU units. But yeah, you do need to do that. And I think that's important because the field changes so rapidly that we need to keep up, and they need to make sure that people are, you know, up to date on what's going on so that you give the right information to your patients. Yeah.
And there was another question. What would you say is the biggest misconception about genetic counseling?
Well, I would say in prenatal work, the big, you know, kind of misconception is that we're trying to create these perfect babies, that we think that, you know, we're designer babies or something like that, you know, and I have always, you know, rebelled against that because it's really not true. And we're there to give people information, to help them make decisions, to kind of help them explore their own values. And it's one of the things I've always liked about the work is that we sort of have to hold all of it. You have to hold well, for me, at least, when I was doing both prenatal and pediatrics, I would be supporting people in some pretty difficult decisions about their unborn babies, while at the same time really trying to promote the health and well-being of people with disabilities. And just it's not a field that's great for really black and white thinkers. I mean, there's a lot of ambiguity and a lot of, ethical dilemmas and ethical discussions, but that's what makes it sort of fascinating. And I always felt like, this technology, some of the technology I don't like, some of it I would say I wish wasn't here, but it's here and it's coming and and yet given that it's here, I've always felt like, well, we need compassionate, informed people to help explain it to people, because it would only be worse if it was here and nobody understood it. And, so that's my perspective. So I do think people have this sense of like, we're really, eugenic, if you've heard of that term, or that we're trying to really create, people without disabilities, which is very, very not true. And so I think that would be a big myth I'd like to dispel.
Yeah. And, the person who asked that question followed up and asked, speaking of that, how do you think the genetic counseling community feels about CRISPR technology one day to help people with genetic conditions?
Yeah, I mean, I don't think I can speak on behalf of the whole community, but I think it's exciting technology. I think people are, happy to have it on the horizon. Like anything, any of these technologies, they need to be well studied and well, rolled out and rolled out in a way that there's, that everyone has equal access to them. I mean, one of the big, issues in this field, like any healthcare is, we have all this great stuff, but does everyone have the ability to take advantage of it? How can people pay for it? Do people, is there assistance for people to pay for it? Because a lot of it is expensive, of course. But I would say people, I'm not sure I can speak for everyone, but I think it's seen as a positive thing, in the right circumstances.
And another question in the chat was, what is your main advice for those who want to take up a career in genetic counseling, especially in the lens of someone in community college? So in the first 2 years of university, basically, like completing your visits.
Yeah, so I would say if you're in, you saw kind of if you really think you want to do it, I would try to take, some science classes and some psychology classes, maybe those two, those would be important but I don't know, your school may have general ed requirements and so on, but anything you can take that seems related to biology, genetics, psychology, anatomy is good, medical terminology is good, anything like that would be good. And then, like we said, any kind of exposure to the field or any kind of peer counseling, crisis counseling, those are the kinds of things I would do. And basically you want to work toward getting a 4-year degree. That's, and if you're already, I don't know where you're all at in your process, but if you're already choosing to major in something else, like I said, you can catch up either in your second 2 years or afterwards. Like I said, I had to go back and I didn't have chemistry. I don't think I had to go back and take chemistry. I mean, there are these post baccalaureate programs and, you can take classes even after you graduate, but you all have time, I think, since you're in community college, you can still take all your, probably take your classes both at community college and if you transfer to a 4-year institution. So yeah, I think you have plenty of time to do it. There's no rush. The field's not going away.
And there's another question in the chat. Do you know if there are benefits between working in a private versus academic setting for genetic counseling besides pay?
Besides pay, is that what you said?
Yeah, besides pay.
I don't know. I think there are, I think if you're interested in doing research, like, people like to work in academic institutions because they're more teaching oriented and research oriented. I mean, so some people like that. Other people have no interest in that and are happy to just work in a private facility. And there are genetic counselors working in small private doctors' offices too. So it depends if you want sort of a busy academic, environment, or you want something that's a little bit quieter and more specialized in, just doing your job. So, but I would say research and teaching are the main differences that academic institutions might offer over a private setting.
Thank you. And if anyone has any questions, additional questions, just put in the chat or unmute. But I had a question. Is there a reason why genetic counseling is so is it the word overlooked? Like when people think of the health field, well, obviously it's part of the allied health field. So do you think there's a reason why people don't think of genetic counseling like when they think of health or anything like that compared to doctors, nurses, stuff like that?
I mean, I think it must be a little bit just historically too. I think doctors used to do it. And again, the field is relatively young because the discoveries are pretty young. We didn't know about these genes until the last, number of years. Like when I started, as an example, I would see a couple who were at risk for, maybe they had a child with cystic fibrosis. We would talk to them and we'd say, okay, cystic fibrosis is autosomal recessive. You have a 25% chance of having another child, and that was all we could offer them. There was no blood test to see whether they carried it. There was no prenatal test. There was no now there's testing they can do pre-pregnancy. I mean, there's so much more that we can offer them. So part of it, I think, is the evolution of the technology and the knowledge has led to the evolution of the career. And so that's the only thing I can think of why it's still not, as well known. I think it's just, but I think it's emerging. I mean, I think you're going to hear more and more about it. I mean, that's why it's been listed as top 12 careers in all these magazines. And, it's definitely gaining, people are learning about it, but it must be just because years ago, there wasn't that much we could do with it, I think, Feel free to help me, Jessica, if you have any other thoughts about it.
Yeah, no, I totally agree. And yeah, just to echo what Laurie said, I think, we're putting a lot of emphasis, lots of people are putting a lot of emphasis on spreading awareness about the career, right? Like that's that committee I'm on that I mentioned, the community outreach. That's one of our big missions, is to just spread knowledge to high school and undergraduate students about the career, and that option is out there. And hopefully one day it will be, something that comes straight to somebody's mind when they think about healthcare.
Yeah, no, that's a good point. I also am a big proponent of starting younger. I have, and my students, we would send them to high schools and middle schools. You want to get people earlier than even where you all are. Many people, there are lots of people who come to it later, but then I'm finding more and more people at least have heard of it by the time, like somebody mentioned, they already want to do it in their second year, in college, which is great, or from a sophomore year in high school, which is great. But that's just starting to happen, that young people are hearing about it. I don't know whether it was again, a salary thing. I don't know whether people thought, well, if I'm going to have to go for a master's degree or for higher education, I might as well just become a doctor. But anyway, so I'm not sure, but I do agree we should start younger, educating people. And I did, I put my email in the chat, I decided. So anybody who wants to contact me individually, that's fine.
Okay. I will also provide the email after this meeting, but I think we have time for one more question, which is in the chat. Do genetic counselors have to consult the patient's doctor before ordering labs?
So it probably varies in different settings, but where I was, we would get a referral from a doctor, like say, an internal medicine doctor or a pediatrician or an obstetrician. They would refer to our genetics department, and then we would work with the patient and decide at what kind of testing to offer them, and we would offer them. And then we were under the, technically we really were working under the medical geneticist in our department. We could order testing ourselves. You don't have to get permission from the referring doctor, but from our supervising doctor, which was the geneticist, they are basically overseeing you. It's just not, so I wouldn't say we had to ask permission because it was kind of an automatic thing that they trusted us and we could do it on our own. But ultimately, they are responsible, which is kind of a good, I see it as a not such a bad thing. I mean, in other words, you were, if people make mistakes, things happen, you want to take your job really, it's really important stuff and you want to be careful. But if something happened, and there are medical malpractice suits and lawsuits that happen, you're never in it alone. Like you always have a physician kind of covering for you and who's ultimately responsible, which I think is a good thing, or I was glad I had that. I didn't, it didn't come up, I didn't need it, but it was a nice thing to know in case something, would have happened that would have made it hard for me, what I mean, if I had gotten in trouble somehow by ordering the wrong test. But we were I would say cancer work and prenatal, the counselors function much more autonomously. The pediatric work, like I mentioned, where you're doing exams on kids, those you actually co-counsel and you're often with the physician in the room. So there's a little bit of difference depending on probably the institution and what type of, what specialty you're working in.
Okay, thank you. If there are any last minute questions, please type them in right now. But if not, thank you so much, Laurie, for answering in our Q&A session. Can we all take a group picture right now before we start ending? So anyone who would like to be in the picture, please turn on your camera so that we could save this moment. But yeah,
Nobody
okay,
coming.
I'll give you guys.
Appreciate how interested and engaged everyone was. I'm impressed with the Q&A was really, often, people ask one or two questions. You guys were great. You had a lot of good questions,
Yeah, great questions.
Okay. I'll give you guys a few more seconds. So please turn your camera if you would like to be in the group picture. If not, it's all right. But yeah. Okay, I'll take the picture in 3, 2, 1. I'll take multiple. You probably hear it. Okay, yeah. Thank you guys for turning on your camera and being in the group picture. Now, everyone give a round of I was just gonna say, everyone, please give a warm thank you and a warm thank you. Yeah, a warm thank you to our guest speakers for today. Hearts in the chat, hearts in the Zoom too. And yeah.
If everybody could take a sec too, I'm just going to drop a link in the chat for a feedback survey. If you have a couple minutes to answer a couple quick questions for the GCPSN, I would really appreciate it. But yeah, great questions, great presentation. Thanks, everybody.
Okay, yeah, thank you. And we'll also send this out for the, would you like us to send this out for the video YouTube watchers as well?
Sorry, the feedback survey?
Yeah, would you like
that
us
would
to?
be great. I can email you the link. That would be awesome, Megan.
But yeah, so if you like to know like the contact information of Laurie and like all the links to the Genetic Counseling Perspective Student Network, we will also be posting it in our socials. So keep an eye out for that, or it's also in the chat. But if you would like to be an active MOA member, please sign out with the word of the day. Can the officer send the sign up form in the chat? Yeah, Emmanuel sent out the sign up form in the chat. And the word of the day is genetics. So if you'd like to earn an MLA point, please. Yeah. And the word of the day is genetics. But if anyone has any questions or concerns, feel free to put in the chat. But other than that, we're pretty much done.
Thank you all very much for your attention, and good luck to everybody in their process, either as becoming a genetic counselor or whatever else you choose to do. Have a good weekend.
Thank you so much for coming in
you.
today and speaking with us.
Thank you.
Thank you.
Thank you.
Let's stop this recording.